All right, everyone. Welcome back to my podcast On My Watch, and I'm your host, Dr. Riz. This is where we take the stress out of healthcare and replace it with a couple of laughs. I'm excited about today's episode. We are planning to take a peek into the future of healthcare, and our guest is going to help with the journey. Today, we're talking about something we all secretly want to know. What will healthcare look like in 5 to 7 years? Well, today's guest is a true healthcare game changer, founder and president of both Rainmaker Consulting and Golden Guardian Insurance. Not one, but two. Before venturing out on his own, he led Belong Health as president, scaled innovative companies like myNEXUS, and as Humana's Medicare CFO, helped steer healthcare strategy affecting millions. He's grown companies, launched companies, raised millions of dollars, and somehow made complex care look almost entertaining. Please welcome a visionary leader shaping the future of healthcare, Johnathan Davis, also known as J Money.
Thanks, Riz. I appreciate it. Look, I'm happy to be here today, excited about this topic. As you know, I'm super passionate about healthcare, the healthcare ecosystem in the country. So let's just dive right in.
Well, thanks so much for being here, Jonathan. The best part of having experts like you on the show is to get a glimpse of what might be coming, not just what's happening in healthcare right now. So I'm going to ask you 3 questions, and I am looking forward to your awesome responses. So let's dive right in.
Yeah.
Fast forwarding 5 to 7 years, I'm imagining self-driving Ubers that also check your blood pressure and offer you a snack over a polite conversation about your weekend. But seriously, what do you think the healthcare future looks like, and how will that impact an average person financially and from an accessibility perspective?
Riz, that's a great question. I think something that's on everybody's mind today. And you hit a couple of things about access and financial focus that really is the topic du jour of the day, right? Healthcare is wholly unaffordable in this country right now. It's grown to 18% of GDP in 2024. That's up from 13% of GDP at the beginning of the century. The forecast for that has it topping 20% within the next 10 plus years and growing. So if you think of healthcare as a sector getting really that big overall in GDP, there are a couple of questions you have to ask yourself. One, what's it crowding out? Because it's growing at a faster pace than the economy is growing. And then two, how can anybody really start to afford this when it's so large and so big? So today, if you don't have insurance, you don't get access into the healthcare system. That's just it, right? If you can't pay, you're not going to get a service. And if you want to test that theory out, go to your local doctor's office and ask them to do a workup on you, but insist that it's going to be free. And don't be an individual that qualifies because lack of means, right? They're going to politely say no and or laugh you out of the office. That's what's going to happen. So if I look forward into the future and think about how do we change this, I think it's a mix of technology that comes in, access to your own data, educating individuals, patients on how to take care of themselves, downskilling some of the care that's received. So some of that becomes potentially AI in the sort of long end view of this. Some of that's lower skilled workers, which is happening today. Some of that really is, as horrible as this may sound, is demand destruction, right? If you think about the forces that are in play today in the U.S. healthcare economy, the basic law of supply and demand don't work. If you go back to your college days, the supply curve, demand curve, where they intersect, that's where your price is for a given something, right? When healthcare, the people that consume it, the demand curve, have really no responsibility again against cost. Now, there are going to be people that watch this podcast and say, the heck I don't, right? But the reality is if you have health insurance, somebody's paying 70, 80, 90% of the bill, right? And they're getting a discount on the bill charges that you're going to see come through. So there's a big disconnect between actual cost of care for the consumer and what the consumer actually pays today. And the only way to really fix the system is to get the system more closely aligned with market dynamics that will allow price to stabilize. So I think, that's shades of what you're going to see. I know people want this uber realistic view or uber futuristic view where robots are going to be doing all these things to us. I just don't think we're quite there as a society yet. Bluntly, I don't want to be laying on a table for a colonoscopy and a robot coming, right? And I'm singing Moon River, right? And it's just, I'm not there, right? Because if I say something and you grunt, the robot might take it as some other command, and God only knows what happens, right? If you're a female and you're, go into the office for your annual, you don't want to see a robot. You want somebody that's there. And that's part of the other side of this, outside of the financial, is the human component, the compassion that comes in. You're bearing some of the most sensitive information in your life to something or someone, and there's empathy that comes through, an understanding and a desire to heal you that you want. Right. So that's sort of the views that I have about the future today.
Oh, that sounds great. That sounds great. There's a couple of things you touched on. One thing is so important is the consumer education. So people need to be more empowered. And this is one of the things that, my podcast does, is to kind of lay the foundational groundwork for an average consumer to understand the basics of health insurance so they can navigate better. And also, to your point, yes, that compassion and care point is so important. I understand that we are just in this technology race today, and AI, as we hear every day, that it's going to take over everything. To your point, yes, if the robot takes the command differently and operates in a different manner, then yeah, that definitely could be harmful. So, point well noted. Absolutely. Let's say that you have a magic healthcare wand, just like kind of Harry Potter did, where you can do stuff with it, right? But you have no budget constraints, no bureaucracy, and no angry stakeholders chasing you down the hallway. What does your perfect future healthcare world looks like, and how would it impact an average American?
Yeah. So I think there's a couple of things you have to think about. One is healthcare has to get more affordable, right? And that's a really tough thing to do, because healthcare is so fragmented and it's so large, again, pushing 20% of the gross domestic product of this country. So you really have to start thinking in incremental steps. How do we get from point A to point B? And this is an example of something that can happen. I have several things that I'm posting on social media that you'll see. So I think first and foremost, you have to empower the individual, right? The patient. You have to be able to connect actual cost of a service with payment of that service without them bearing the brunt of that. If you think of the health insurance industry today, which is the financing arm of healthcare today, you really only see what we have today starting in the 1990s, though health insurance has been around for a lot longer than that. If you go back into the 80s and even the 70s, you don't have a health insurance policy that covers everything. You have a major medical policy that will cover an inpatient admission with limits on how much you'll get paid. And then you'll have a doctor's policy that will pay up to a certain amount on a given year, right? And you manage your money accordingly as you need to. Only until the 90s did we really get policies that took those limits off, put lifetime limits on, like $1 million, $2 million, $5 million, that really are hard for an individual to hit, and even harder when you're changing insurance companies because you change employers, or if you're Medicare eligible, right? You're changing insurance companies potentially annually. So you've got to be able to get back to policies where an individual is empowered to make a decision because there's budget for them to manage against. That's number one. Number two, the cost has to come down. And I think, again, when you get some of that demand destruction and you put the power of the purse back in the consumer's hand, again, letting that natural market equilibrium find itself, you're going to start to see that price come down over time. Three, I think we have to get to a point in this country and in society where, again, we've empowered people with information where they can provide some self-care. You start to see shades of this today. The wellness company, which, by the way, I don't have any stock in, I have no financial interest in, but I see them advertised on TV all the time, where they will send you 4, 5, or 6 prescriptions if you buy their kit, right? And they'll give you a list of symptoms that you read through. And if you have those symptoms, take this pill and you'll get better.
Right.
I think that has some shades of good and some shades of bad in there as well, and needs to be walked through carefully. But I certainly think there's part of that. And then we get to technology, right? Technology plays a key role in this. Number one, you've got to empower people with data. So going back to the mid 20 teens, one of the last things Obama did when he left the office, by the way, this isn't going to be a political statement. It's just factual what's happened. The 21st Century Cures Act was signed. And part of the 21st Century Cures Act said, hey, people have to get access to their data. And they should be able to get access to their healthcare data free of charge. You can't charge them for it because it's, in fact, their data. And if you call your local hospital or your doctor's office or whoever, your insurance company, they'll send you your data for free because they have to. The problem is when you get it, it's impossible to use because I've actually tested it out with my doctor's office and I got a spit out of data. And it was literally by data service, everything that they did and then clinical notes. To spend any time in that, filtering through and trying to figure out what's going on and how I use that, how it's impactful is near impossible for any individual, especially in today's society where schedules really pack full. 40-hour jobs are really 50-hour jobs a week. And then you have kids, soccer and baseball games and high school stuff and blah, 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 blah that interact. And, parents are getting older, kids that are sick, et cetera, that you have to take care of. So you've got to be able to take that data and you've got to put it in a form where it's information that's easily consumed and that information creates engagement and gives a call to action for somebody to self-care. And that's important because if you think through healthcare system and how it works today, when you're getting discharged from the doctor's office, when your visit's over, or when you go to the ER, you have an outpatient procedure, you're getting discharged from the hospital, a nurse comes in to read your discharge orders. And that nurse in that moment in time sounds like the best auctioneer you've ever heard in your life because they are running through those things like crazy, right? It's not their fault, right? Their job is to get you educated at the door and get that room turned over because somebody somewhere is fussing at them. That's money lost. You've got to get more patients through. We get more patients through. You got to turn rooms over. You got to turn beds over. And that's the process they're going through. They're trying to meet the demands of whatever master they have. So you listen to it, you get home, and like I've been in healthcare for 31 years. There are times when I hear stuff. I get those 5 pieces of paper, fold them up, I'm out the door. I go to Chick-fil-A or whatever because I survived the visit, and then I come home, right? And then I have to think, what am I supposed to do again? I have to go either read a piece of paper, which sometimes is very educational, other times reads a bit like the Encyclopedia Britannica, and your eyes glaze over, right? Because you get the TLDR and you move on, right? Or people do read it, or they just don't understand what they need to do. So, healthcare today works really, really good in the box that you go to, right? And that meaning if you go to a hospital, if you go to urgent care clinic, if you go to a doctor's office, you're going to get great care while you're there. Well, most of the time. I actually had examples where I couldn't care in an urgent care center, but you're going to get good care while you're there. The second you walk out of that building, you're on your own. You're on your own. Nobody's there to help you. The healthcare system doesn't care about you in that moment. I don't mean they don't have empathy, that your doctor there was caring for you, doesn't want you to get better, but no one's there to hold your hand. That's where I think technology comes in. Technology does 2 things. It bridges time and space, and it makes you more efficient. And if it doesn't do those 2 things, you should throw it away because it's worthless technology. Take data, make it into information, and then engage somebody through an app on their phone, as an example. Through an app on their phone where they can talk to a nurse and make it easy. It's going to take you from where you're at today to a large step to controlling some of the costs that you need in this, or controlling healthcare spend in this country, because you're now enabling people and packaging that together with economic realities of you got a budget. And how do you need to manage that budget? Because most people don't know how the human body works unless you went to medical school, right? You just don't. And WebMD is good, and there are other services out there that are good, but they're only so good, and they use really big words, and you don't always understand what those words mean, and you just want to talk to somebody that's an expert. That's why you go hire a doctor to help you out. So taking that data, making it more accessible is great. AI is probably not ready for this today. It is 5-10 years away, I think. from being ready. And I've played a fair amount with AI tools that are out there today. The money that's being spent on AI is largely in administrative services today, based in healthcare, in the health insurance space and in the physician office space. You do hear things about, hey, AI reads x-rays better and detects cancer better than doctors did. I'll pass the bar exam. All those are probably true. I haven't looked at the studies. They're probably true. But I can tell you from talking with doctors and talking with nurses and running and operating companies in healthcare, no one has the liability of AI making a medical decision today. And no one trusts AI to make that decision because the models are still being trained and it's still learning. But for administrative services, I think in the early go, like answering a call for customer service if you're a health insurance company, helping you schedule an appointment if you're a doctor, right? Being able to bill your bill, right? Being able to pay a bill if you're on the insurance side. All of those things I think are services that AI is well trained, can be well trained for in the near term and lowers admin costs, help lower cost overall in the healthcare space.
Great points. There's just a couple of things I wanna mention here. One is, yes, wellness education is very important, no doubt. We need to focus more on wellness. Prevention is better than cure. I mean, it goes back to that principle, right? So that I totally agree with. And then when leveraging AI or AI tools, like ChatGPT would only answer what you ask ChatGPT. If you don't know what to ask or how you want that AI tool to help you, then you're at a loss. So yes, education is very important in that aspect. And the third thing I wanted to touch on about what you mentioned earlier is care management. I really believe that care management is very important. And because we have lack of resources, we're always on the go, go, go mode, right? So maybe, focusing a little more on care management may help elevate that whole wellness mindset and engagement.
Yeah. And, for caregivers or care management, really, you need a few things. You need somebody that's educated in healthcare, and that's usually an RN or an LPN today. That's some nurse that can help guide you and shepherd you through as a navigator through whatever care plan you have. And then if you're able to care for yourself, great. If not, you have to have a willing and able caregiver by you to help you through that process. And if you don't, there's a gap in the healthcare system. Sometimes that gets filled by home health. Sometimes it doesn't because the financing mechanism doesn't pay for it, for the need that you have. Right. So those are things that you think about care management that you really have to keep in mind as you go through a process. And the other side for care management is the patient ultimately has to be able to pick up the phone and listen to you, because there's a lot of scams that go on today. There's a lot of fraud that goes on in healthcare today, unfortunately. There's a lot of scams that have nothing to do with healthcare that go on, and people are leery to pick up their phone for a number that they don't recognize. As a matter of fact, if I don't know the person that's calling me, it's probably going to go to voicemail. Right.
That's absolutely true.
And almost everybody I know operates under the same guise because they don't want to deal with the scammers. Right. If I have free time and I'm in a frisky mood, then I'll go play if I can. But the scammers won't let you play with them anymore. They just hang up on you, which is really disappointing.
Yes. And it's very discouraging to hear some of these stories where, seniors get caught up in this whole scam, you know.
I have family members that have been scammed out of tens of thousands of dollars.
Absolutely. Yes. Yeah. True. Okay. So I'm going to get to the next question here, which I think is very interesting. So with AI and other technologies evolving rapidly, how do you envision the delivery of care changing for patients without giving them like a tech headache, just in simple terms, I guess?
Yeah, and I think we touched on this a little bit already. If you look at, for those that went to business school and those that didn't go to business school, technology adoption or product adoption is like this curve with a wave in it that starts really, really small and gets really, really big. So when the iPhone first came out, or a smartphone first came, and the iPhone was the first one, The early adopters for tech ran to that because it was the shiny new toy. And then they started to figure out what it was and how it works. And then it grows from there, right? If you go back before the smartphone, texting was a thing, but it was a huge thing, right? It was there, people were doing it, but in my sphere of the world, probably half the people I knew did it, half the people didn't, because it wasn't the easiest thing to do because you had to hit the number 4 3 times to get the letter, number 5 2 times, etc. And when you got a smartphone, you got a keyboard, right? That helped you do that very, very easily.
Right.
And that adoption, because of a service or feature, helped explode and grow. So the example I'm using there is that AI is in its infancy. There are people that are tech friendly that are playing around with it today. I use it literally every day. Help me out with something on the 2 companies that I watch, right? Boulder Guardian and Rainmaker. My wife is probably on the other end of the tech spectrum. She cannot stand technology at all. It's like the one thing she hates to ask me to do and the one thing I really hate to help her with, because she doesn't really want to learn and I just want to teach so that, if I'm not around, she can service herself, and that's not really what she wants out of the process. And I think that is a microcosm of society as a whole, right? You're going to get people that will be willing to listen to AI and use it on a test basis. Today, I would tell you from the models that I've seen, AI is not ready for care delivery, right? We're just not there as a society. And the models aren't ready for that either. The AI that I use, I find errors in from time to time. Well, I ask questions and I'll catch an error and go, that's wrong. And when I tell it like, oh yeah, you're right, that is wrong. I didn't use the output of it, but I was trying to use AI for branding for one of my companies. And I liked the design it came up with. And 40 minutes later, I was trying to get 2 simple things done and AI couldn't comprehend what I was trying to get it to do. And I finally went and hired some fractional labor. So those are examples where it's early, right? It's just really, really early. And because the simple things aren't working, the really complex things of care, you're not going to see get there. I do think in 5 years, though, again, for some of the simpler things in this world, I have the sniffles. What are your symptoms? You key it in. Well, here's what you need to know, right? Now, here's the thing about AI. Everybody says AI, AI, and they think about Chat GPT or Grok or Gemini or the other free tools that are out there. But if you're a company and you're going to use AI, somebody's got to pay for that, right? These models cost a lot of money to build. The data center and the energy they consume cost a lot, right? So today, if you're going to use AI and you're in a company, you purchase it, you have to pay for so many hours or so many minutes, and it's not cheap. The AI company will customize whatever bot or service you're looking to do what you want. They're very, very helpful, very friendly to do it. But the cost to do that is billions. And if you look at some of the recent articles that are there, NVIDIA has sold a lot of chips, but they also have an inventory. If you listen to the recent earnings call, and that inventory hasn't really come down. So there's a question as to, well, why is that inventory there? If AI is here and it's the big new thing, why do you have this glut of chips that's sitting there, right? Some of that could be because we're waiting for data centers to get built. Others could be it's just not moving as fast as you want to. The companies that I know a little bit about in AI are slow in generating positive revenue right now in the healthcare space. Today, early on, not a lot. Fast forward 5 years, I think you're going to see maybe 7 years, 5 years, early adopters using AI to self-diagnose, right? And with any of this, you have to have the ability to opt out and be able to talk to a physician, because I don't think society will ever get to the point you don't have that option. And I think early on, anything that AI does will be checked by a physician, and then you'll be followed up with, or in real time, it'll be corrected if it's wrong. And I think 7, 8, 9 years down the road, then you're going to get to a point where, AI can handle a lot in medicine, and we will have to adopt to that as a society. That's just delivery of care. We haven't even talked about pharma in any of this.
Right.
Uh, you know, Pharmaceutical costs to outside of AI, but if I had that magic wand you talked about earlier, PBMs have to go away. And if you think, just zoom out and look at the industry, The three largest PBMs are owned by three very large health insurance companies. And I'm not saying those companies are bad. And I'm saying, well, I actually am saying PBMs are bad just because there's a black box that's there, right? And I've heard horror stories recently where somebody, a friend or acquaintance of mine, knew the CEO of a drug company, and they were getting ready to launch a new drug. And the CEO went to the PBM and said, "Here's the price I want to charge." And it was well below all the competitors. He said, "I'm taking market share because my drug's superior." And the PBM said, "We will not list your drug unless you increase your price by something like 300 or 400%. It was a really big number. Readers are going to say, "Well, none of that's verifiable, Jonathan. That's all hearsay." I would agree with that, right? So the viewers of this can take to heart. And this is verifiable. GLP-1s are the greatest thing on sliced bread right now. You see the commercials, and they work. They will lower somebody's weight. And for people that are in the upper end or in the bad section of BMI, to get you back down to good BMI. And obesity is a disease. I'm not saying it's not. There are a lot of bad things that happen when you're obese. The drug works, and it works really well. And all of them work well, right? The problem is you have two different prices that are being charged today. So if you go and pay out of pocket for Ozempic, Wegovy, Mounjaro, Zepbound, you will get one price, and you're going to pay somewhere between $300 and $500 a month for that drug if you pay out of pocket. And I understand, like, that's a lot of money, right? That's a cost on a monthly basis, and not everybody can afford that. That's why you have insurance. If you bill your insurance company for any of those four, the insurance company's not going to get charged $300 to $500. They're charged over $1,000 for the same drug you paid $500 for. Why? Why is the insurance company being charged twice? I get there's administrative effort from sending that bill in, getting it approved, and getting paid, but it's not 2x the cost. It's not even close to 2x the cost, and you're not going to convince me that it is. I don't think you convince a reasonably prudent person that it would be. So you've got to be able to get drugs from the noise that it is today down to a level that's controllable. And it is what it is today simply because the system has allowed it to be that way, right? There's about 15,000 pharmaceuticals that exist in market today. And if the insurance company pays the price, then you're going to charge the price, right? The patient wants the drug. The patient gets the drug. You pay the price. That's, again, back to that supply-demand curve I talked about earlier, and where things just don't quite work. When demand controls the supply, you're going to see price get back to equilibrium. It's really easy to make that statement, but when you're talking about a cancer drug or a hemophiliac drug or drugs for people that have sickle cell or just simple drugs, right, like cholesterol medication or high blood pressure medication or insulin. Those are drugs that in insulin is a more immediate effect of an acute health event, but the others are a little bit longer term, but they're drugs people use every day. You start thinking about costs of that, and it has a real impact. And you start rewinding the clock back to the early 2000s when the federal government said, "Hey, seniors are choosing between feeding their dog or feeding themselves and medicine on a monthly basis, and we got to fix that." And we can't let that happen, but we do have to be able to ease this down over time, and it's starting to control that demand.
I totally agree with the PBM comment you made. I mean, but I don't know what the gravity of the whole situation is with the admin and the drug management and all that. But if you take PBM out of the equation, not sure how that would totally impact the drug administration, the overall cost, and the overall operation. But that's definitely a very good point. And I'm just going to segue into the next question that just kind of, what is like one digital tool besides a time machine, of course, would you develop in an ideal space to meaningfully enhance access and convenience in healthcare?
Let's talk about access. So there are two things I think you have to consider when you think through access in healthcare. One is financing of healthcare today. No money, no access. That money comes largely through insurance companies today. The other is just supply of clinicians. That's it. So when you start putting more volume into the system, right, through whatever means you want to do it, whether it's through social service programs, whether it's through subsidies on the exchange, whatever, right? When you get more volume coming into the system, then the system only has so much supply it can give. Because today, again, healthcare is provided by somebody that's got an MD or a DO after their name, or a PA, or a nurse practitioner that's got
No, sure.
right. That's how it gets delivered today. One, we've got to be able to get more supply on the clinical side, and it takes a long time to make a doctor, right? It's on the short side, 12 years to become a physician that can practice on their own and have a license and all this other stuff. And if your specialty, it can take quite a bit longer. That's why I think technology has to move to take some of the lower hanging fruit in healthcare out, because you're not going to replace that, right? And you don't really want to lower standards to get into medical school, because you don't want the guy who failed math or the girl who failed math in high school being your doctor, right? And it doesn't mean they can't get there, but the picture I'm painting is you want somebody who's really, really smart and dedicated and that wants to heal somebody and has empathy towards you. That's why medical schools don't lower their standards, right? But there are fewer and fewer people applying to medical school today, and fewer people I know that are graduating that are going into medicine today. The incentives to go to medical school and be a doctor and be that noble profession that it always is, which is to help people and to heal people, that vision needs to be restored, but they also need to be able to make a living wage. So I know doctors, I know people right now that are MDs, that Harvard educated MDs, they graduated, or Penn educated MDs, so Ivy League schools, graduated, did their fellowship or internship rather, residency, done with it. So they're licensed, they could go practice, and they either work in private equity, right, evaluating companies, or they work for value-based care companies, because they can make more money doing that than they can practicing medicine.
Wow.
It's just the harsh reality of it.
Well, yeah, that's true to a certain extent, for sure. Yeah.
I've known doctors that practiced, and they work for a large multi-specialty practice, but they refuse to just send patients through their practice like cattle, right? One right after the other, rushing them through, and they took time to listen to patients. So their average visit time was 10 minutes versus 2 minutes. I mean, think about when your doctor walks into your room today, you are physically in the room with somebody that has MD after their name for 120 seconds or less most of the time.
Yeah.
Because I'm not saying that they're providing bad care. Don't misconstrue what I'm saying, but the reality is they're not in that room long at all, right? And when you are in the room longer, and my own PCP has spent more time with me because I have a lot of questions for recently, that just delays or reduces the number of visits they're going to get in a given day, because they have lives, they have families, they have business interests outside of that practice, because that practice is a business that takes their time and demand, right? So when you think through that side of the supply curve and the pieces and parts that go through it, you've got to be able to create capacity and take some of the volume out, so that the time that's spent in front of somebody is for those that are most chronically ill individuals in society, and those that aren't, the sniffles or the flu or COVID or the like, are able to be diagnosed and get the help that they need, but certainly in a manner where they can get to it. And I mean, just think about a specialist, right? I was thinking more primary care doctor in my comments there, but think about a specialist. So my wife, as an example, is going to have surgery next year. She saw the specialist end of October, 1st of November.
Okay.
Paid up her mileage, she's going to get the surgery, called within 2 or 3 days of the visit. The first available, it's a surgery that will require 3 separate surgeries to complete the process of what my wife needs to have done. The very first time my wife could get the first surgery done was more than 90 days out. I've known people that had breast cancer, and the earliest they could get a mastectomy done or a lumpectomy done was 90 days out, because that's the first opportunity the doctor had. Like, think through that, right? Like, 90 days of cancer's growing in your body, and you don't want it growing in your body, right? You have a behavioral health need, right?
Well,
getting access to, well, no one blind. Health insurance companies just don't have great behavioral health networks as a general statement. And the reimbursement that they give the clinicians isn't that great. And that's not me saying that, that's me talking to psychiatrists and them telling me, here's why this is a problem, because I don't get paid enough, right? I don't take Medicare because Medicare doesn't pay me enough, because I lose money every time a patient walks in the door. I'm running my practice. And that sounds harsh, but that's the reality in any business. If you sell a widget, every time you sell that widget, you lose money. You would never sell that widget. You would adjust your price, or you just wouldn't sell the widget anymore, right? And
true.
while healthcare is very personal, you also have to realize it's a service. It's a product that's being delivered, and somebody's got to provide that. But if you have the cash to pay out of pocket to go see a behavioral health specialist, you're going to wait a very long time.
Oh, very long time.
And see, then once you're established, you can get on a cycle, but it's a long time. So zoom out and think about that. If somebody that's schizophrenic, depressed, anxious, dementia, right? Any of those where they need help from a behavioral health therapist, right? And maybe dementia is not the best example here, but the other three, depression, anxiety, and schizophrenia, which are prevalent in our senior population, you get out of the hospital and you run out of your prescription medication, or worse, it gets seen or diagnosed in the hospital that you're schizophrenic or that you're really depressed, and you get out of the hospital. Think about that behavioral health need and what it does to your physical health, right? What if the voice in your head says cooking that egg is going to kill you? You're not going to do that, right? You're going to self-protect yourself. Or you're really depressed, you don't want to get out of bed for 7 days at a time. You're not going to eat, you're not going to clean yourself, you're going to have poor hygiene, your skin's going to suffer because you're not cleaning yourself, blah, 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 right? All of this goes into lack of providers, lack of funding, or misaligned funding, and going to take capacity out of the system because you can't replace the supply or increase the supply fast enough to keep up with the demand that's there.
No, I agree. And if you shift it back to like younger population that's non-Medicare, that have Medicaid, the reimbursements are even worse.
Okay.
So, and a lot of these psychiatrists would not even accept Medicaid, so that even makes it more challenging. I completely agree with that.
And, at that point, poverty is not a crime. It's not. And we treat it that way in this country. That if you're poor, you're treated in a lot of ways like a criminal, even though you're not. We have to get past that stigma in society and realize that people that need help really do need the help. And there's got to be a way to solve that. I have ideas on things you could do, but there's got to be a way to resolve this, right? Easily.
I agree. I totally agree. And I love it. Honestly, everything you described today makes the future sound less scary and more user-friendly. It is refreshing to hear a vision where healthcare isn't just high-tech, it's actually high-touch and human at the same time, because empathy and care are really critical pieces of healthcare. So thank you, Johnathan, for joining us and giving everyone listening a peek into what's coming next. And for the audience, if any of this made you go, wow, I wish that existed now, sing. We're all in this together. I would love to see you back on the show, Johnathan, so you can share all the futuristic progress you've made in healthcare. Any other takeaways from your end, Johnathan?
The tech I talked about, I have a clickable prototype of an app that I built a few years back, but I've been so busy I haven't had time to play with it. So, maybe 2 companies is enough, maybe 3 companies is the focus that I need to have on it.
Well, with a man.
Last thing I'll leave you with. So this is something we could do, I think, from a policy standpoint. You don't have to do policy, not to go to federal government for this. Private companies could do this. Health insurance companies contribute. Large hospital systems contribute to this. You could create a public fund, right?
That sounds good.
Right. And not talking small, tens of millions of dollars get contributed just to kick this thing off. It's a not-for-profit, and that not-for-profit would contribute to helping the cost of individuals that can't afford healthcare or can't afford to pay a copay that they need to have, right? So more people, middle income people that just don't have enough money to get the care that they need. The fund's not controlled by the insurance companies or the hospital systems, though they could have representatives that from an executive oversight structure would be there just to help understand and set structure. Private citizens are the ones that get to vote on it, right? They get elected, much like you do to Congress, for a 1, 2, 3-year term, maybe a 2-year term to start. They get blinded information sent in, limited number of cases are reviewed, and they choose, yes, we'll give $1,000 to this, $10,000 to this, and they've got their budget to work with. You can do that today, easily do that today, right? No one has to go through Washington to get that done. Private companies can work together to get that established easily.
I like that idea. I mean, if we can work collaboratively and also kind of join forces, yeah, something like that would kind of address at least some of the underlying issues that are preventing people from accessing care to begin with, much less the cost. That's part two.
It's not the panacea solution. It doesn't necessarily address costs, though I think it can help with the right structure set in there. But it does help ease the pain. And if you're thinking about affordability in this country, people aren't looking. Look, everybody, I've been in the health insurance business and healthcare business so long, right? I don't know anything else. Everybody wants unlimited access, unlimited free healthcare, and they want their health insurance company to have a low premium and no copays and co-insurance. Everybody really gets that. I want that, right? Why not? The reality is it's just not there today. And I think when you start thinking affordability, they just want a little bit of relief, right? They just do. And that's what I think we have to start moving toward as a society is incremental gains that help. And it's not go tax me more and then we distribute. It's let the private market take care of this itself, right?
Right.
So large insurance companies, which aren't solely insurance, do make a lot of money. There's no denying that, right? Large hospital systems make a lot of money. Large pharma companies make an obscene amount of money sometimes.
Tons of money, yes.
Some of those profits and set it aside, right? Doesn't even have to be a healthcare company, though quasi-healthcare companies, right? Apple has a health app. They've been in the healthcare game for a while. Google is into healthcare, right? Mark Cuban's got some healthcare companies that are sitting out there. You could argue Elon's into AI really heavy, and there's some healthcare view that they have. Just saying, right? Private equity could contribute some of their profits to this because there's certainly a number of the private equity companies that are out there. It's a very achievable thing to do. You could get hundreds of millions of dollars in reserve and tightly control, right? This really isn't a hard thing to do. You can have this set up in 90 days or less easily.
Right. No, absolutely. And Amazon is another great example, for like $12 or for $15 a month, you have access to, virtual care. You can get like some of your basic needs heard as far as, your medical needs are concerned. And you can get like a prescription and everything. And that's just $15 or $14 a month. So that's also pretty awesome. Thank you so much, Johnathan. Thank you again. And everyone listening, if you enjoyed this glimpse into tomorrow, hit like, subscribe, follow, and share it with someone who needs to time travel. I am your host, Dr. Riz. We'll see you next time here on My Watch. Stay informed and stay out of trouble.